The member for Etobicoke North has made several speeches on this issue, this health issue, and others, and her speech is certainly well worth reading. I heard her tonight where she actually quoted herself, which is not something we normally highly recommend, but in her case I accept it because it is such a good speech that she made initially that she is quoted from tonight, and it bears repeating because every point in it is very, very important to the debate that we are involved in here. With an increased investment in research, we will learn more about prevention, possibly even discover a treatment to delay the onset of the disease and reduce its impact substantially. Other findings from Rising Tide, Madam Speaker, include pressure on the healthcare system. In 2008, more than 103,700 people developed dementia. By 2038, 257,000 new cases per year are expected. That will mean extreme pressure on families. The hours of care delivered by unpaid family members are expected to more than triple, increasing from 231 million hours in 2008 to 756 million hours by 2038. And I indicated my friend in Winnipeg, and there are just dozens of people in this situation, are literally tied to their homes and tied to their loved ones and unable to get away. And that's why we have to look at home care programs. I know Manitoba has one of the first home care programs in the country. It's an excellent program, but I don't know what the situation is with home care across the country. I'm not certain of my time, but I wanted to mention the issue, thank you, Madam Speaker, the whole issue of changing the way doctors are compensated. For many, many years, back in the 70s, I know the health minister in the 70s in Manitoba, under the Schreier government, looked at Minneapolis, Minnesota, where they had a different system of paying doctors. It was known as the capitation system, where you had a number of doctors in a given area, and all of the patients from that area had to go to those doctors. So you lost your choice in doctors, but one doctor would take care of an area. As an improvement over that, we have situation in Europe where doctors are paid on that similar basis. It's similar to that type of capitation system, where they're paid for the outcomes. So if let's take smoking as the easiest example to understand, that if the doctor is able to get you to quit smoking, then he or she gets paid on that basis. So on this basis, they would look at the symptoms for Alzheimer's, for example, and realize that if you're around 65 years of age, that if you can develop an exercise program, for example, to get that person to lead a better lifestyle, then the doctor's compensation would be based on that, as opposed to the system that we currently have right now, which I think we can all agree needs some improvement. Even doctors themselves will probably agree that it's time to take a look at a better system. Now, the member indicates that it's a provincial matter. Well, not exactly, because I can tell you that the federal government has a large role to play in the area of health care. And it is incumbent upon he and his government, he's part of the government, to get the provinces together, call the provinces together and start discussing this whole issue about how we can better change the compensation system for the doctors, so that they have a system now where they can take a patient and they can anticipate what may be going wrong with that patient and develop a lifestyle change. If the person is having diabetes, we know that the diet is a big part of the rehabilitation of the person. But how many doctors actually put the person on a proper diet and then follow up on the diet? They basically, in essence, from the patients I know who have diabetes, the doctor simply prescribes them a bunch of medication and lets them keep eating cheeseburgers and hamburgers, which they shouldn't be eating. So there's not that interest and not the incentive for them to take care of the entire situation. Thank you, ma'am.
Okay, resuming debate, the honourable member for Oak Ridges Markham can begin his comments. There's about 8 minutes.
Thank you, Madam Speaker. Madam Speaker, I'm grateful for the opportunity to speak today on this motion, and in particular to talk about some of the good work being done by the government to address this health issue. With the aging of the population, more people will develop Alzheimer's disease or related dementia. The number of Canadians afflicted is expected to rise substantially over the next 30 years with the aging of the baby boomer population and the health needs that go along with it. Madam Speaker, I am firmly of the view that it is through investments in research that we can unlock the potential to lessen the burden of Alzheimer's and dementia, not just on individuals and families, but also on the health system. Let me offer one example. It has been estimated that delaying the onset of Alzheimer's and dementia by only 2 years would reduce its cumulative costs over the next 30 years by an estimated $219 billion. Delaying onset by 2 years would reduce the number of cases in Canada by 410,000. That is the promise, Madam Speaker, but we will see that promise realized only through research breakthroughs. That's why I'm proud to say that through the Canadian Institute of Health Research, the government has invested over $88 million in research into the causes, treatments, and potential cures for Alzheimer's disease and related dementias since 2006, including $22.7 million in 2009 and 2010 alone. Through these investments, Canadian researchers in this field are recognized around the world for their excellence. Federal research funding facilitates their efforts in discovering ways to prevent, diagnose, and treat this devastating illness. Our investments include CIHR's commitment of $2.5 million over 5 years for the Dementia Knowledge Translation Network, which will share information about dementia with a wide range of players in our healthcare system. What's more, CIHR is investing $30 million in the Canadian Longitudinal Study on Aging, investing neurophysiological, social, and economic issues of Canadians aged 45 to 85 over the next 20 years. CIHR, like many funding organizations worldwide, has recognized there is a global imperative to act on the rising tide of Alzheimer's disease and related dementias. That is why it has recently established the International Collaborative Research Strategy for Alzheimer's disease. This international strategy will encourage scientific collaborations between researchers in Canada and other researchers around the world. The objective is to establish joint funding partnerships which will address the growing national and international issue. This international strategy recognizes that presently, treatment that follows a diagnosis of Alzheimer's or dementia occur too late in the course of the underlying disease after permanent damage to brain cells has actually already occurred. Therefore, the international strategy's research agenda will focus on the early events in Alzheimer's and dementia. In doing so, experts will examine research problems that are biomedical and clinical as related to health services. Social, cultural, and environmental influences on population health will also be examined. The goal is to identify the disease early so that measures can be put in place to delay its onset. CIHR is working closely with the Alzheimer's Society of Canada in putting together this international strategy. Our government has already signed several international agreements and funding initiatives with France, the UK, and Germany, who will work with us to combat this global health problem. Additional partnerships are being developed with China, Belgium, and the US. All of this work and leadership on behalf of our government will be a huge asset to the provinces and territories in the delivery of their healthcare system. Madam Speaker, the motion asks for the recognition of the important role played by civil society organizations such as the Alzheimer's Society of Canada in advancing our understanding of Alzheimer's and dementia. In addition to the partnerships mentioned above, I am pleased to note that CIHR is working closely with the Alzheimer's Society of Canada through its Institute of Aging. A program called the Cognitive Impairment in Aging Partnership has invested $32 million to date in linking researchers and key stakeholders to advance strategic research and knowledge translation on cognitive impairment and dementia. Madam Speaker, with investments in world-class research excellence, Canada has built a number of distinct global advantages. an excellent track record in Alzheimer's and dementia research, a reputation for high-impact research, and CIHR's strong reputation for partnership and innovation in health research. Canada is fortunate to be an ideal site for clinical trials and large population-based studies, such as the Canadian Longitudinal Study in Aging. Our expertise and resources will enable us to be poised to develop a better understanding of the risk factors around Alzheimer's and dementia, particularly regarding genetics, nutrition, and lifestyle. I expect the future will bring promising developments in early diagnosis with new findings in genomics, diagnostic biomarkers, brain imaging, and physiological and cognitive testing. I am hopeful that these findings will lead to the new approaches in early intervention with therapeutic clinical trials with a focus on prevention. We will learn how control of blood pressure and cholesterol, exercise, nutrition, mental stimulation, and aspects of the social environment can impact on this disease. Our goal, Madam Speaker, is to prevent and mitigate the toll of Alzheimer's and dementia on individuals and society by leveraging our track record in research and galvanizing the Canadian research community by building partnerships with users of research knowledge and mobilizing coordinated and innovative international research efforts. I am confident that we will make substantial progress to this goal, Madam Speaker, and I'd like to thank the member for Edmonton-Leduc for his hard work in bringing this forward today, Madam Speaker. Thank you.
The time for private members' business has now expired, and the order is now put on the bottom of the order of precedence on the order paper.
In accordance with Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time.